Have you ever wondered if something as simple as a supplement could tackle one of the most common issues men face as they get older? You're definitely not alone. According to the National Institutes of Health, many adults over the age of 60 take at least 4 different supplements every single day. But do any of these actually help reduce an enlarged prostate? Today, we'll explore the surprising truth behind popular prostate supplements, the scientific data surrounding them, and why some studies paint a far less rosy picture than you might expect. We'll also look at some of the potential benefits and side effects so you can decide if supplements are the right path for you or if you're better off considering other treatment options. Before we dive in, I want to invite you to subscribe to our channel if you haven't already. Simply hit that subscribe button and tap the notification bell so you never miss our latest updates. Your support truly means the world to us. If you find this video helpful, please give it a thumbs up. It really helps share our message with a wider audience. I'm excited to hear your thoughts on today's topic. If you enjoyed the content, type yes in the comments below. If it didn't resonate with you, let me know by typing no. Your feedback is incredibly valuable and helps me craft videos that better suit your interests. Let's get to it. An enlarged prostate, also known as benign prostatic hyperplasia or BPH, affects a significant number of men. By the time you reach 80 years old, research suggests that around 80% of men will experience some degree of prostate enlargement. Those who have it can struggle with an array of symptoms like weak urinary stream, difficulty emptying the bladder, needing to stop and start while urinating, or even experiencing a frequent and urgent need to go. Sometimes you can't even make it to the bathroom in time. These bothersome symptoms prompt many men to look for natural, non-pharmaceutical solutions. Enter supplements. Why supplements are so popular? The term supplement often refers to plant-derived or plant-based products, sometimes called phytotherapeutic supplements. They've taken on a life of their own, particularly among older adults who prefer natural remedies over traditional medications. But not all supplements are created equal. Even if you stick to one brand, the specific amounts of active ingredients in each batch can vary, making it tricky to know if you're getting the right dose. A particularly eye-opening study looked at 27 brands of saw palmetto supplements, a botanical frequently marketed for prostate health, and found wild fluctuations in the content of its key ingredient, known as free fatty acids. In some bottles, there was almost none of the purportedly active compound, while others had up to 95% of what was claimed on the label. This is a big deal because consistency matters. If the product's active ingredient isn't present in the amount you think you're taking, you won't get the expected results. Inflammation and hormone blockers. Before we zero in on specific supplements, let's talk briefly about how they're supposed to work. Many claim to reduce inflammation in the prostate. Inflammation is a known factor in prostate growth. Other supplements may also interact with hormones, particularly with something called 5-alpha reductase, an enzyme responsible for converting testosterone into dihydrotestosterone, DHT. DHT is a powerful male hormone that contributes to prostate enlargement. One of the prescription medications used for BPH, finasteride, specifically blocks this enzyme and has a proven track record of shrinking the prostate over time. Some supplements aim to mimic that mechanism, but do they actually succeed? Let's examine each one in detail. Number 1. Saw palmetto repens. Saw palmetto is a berry from a dwarf palm plant, and it's been the poster child for prostate supplements for years. Early research in the 1990s was promising, creating a surge in popularity across the US and Europe. People gravitated to it as a more natural way to manage BPH. But as time went on, higher quality, larger scale studies started questioning the benefits. One notable study was published in the New England Journal of Medicine, which is one of the gold standard medical journals. This was a double-blind, randomized controlled trial with 225 men who had moderate to severe BPH symptoms. Double-blind means neither the participants nor the researchers administering the supplement knew who was receiving saw palmetto and who was getting a placebo. After taking 160 milligrams of saw palmetto twice daily for a whole year, the results showed no statistically significant difference in symptom relief, urine flow rate, prostate size, or quality of life compared to those who took a placebo. Then, a follow-up study in the Journal of the American Medical Association, JAMA, in 2011 enrolled more than 300 men in multiple centers across North America. Participants started at 320 milligrams of saw palmetto per day, a commonly recommended dose, then escalated to double and finally triple that amount over 72 weeks. Yet again, the results were underwhelming. There was no significant difference in symptoms or prostate outcomes compared to placebo. Ultimately, a large-scale Cochrane review, an organization that conducts systematic reviews of clinical research, looked at 17 randomized controlled trials involving over 2,000 men. When they focused on high-quality, long-duration studies, they found the same thing: no meaningful improvement in urinary symptoms or flow rate for men taking saw palmetto. However, some individuals do still swear by saw palmetto anecdotally. It's also considered relatively safe, so if you're interested in giving it a try, it may be worth discussing with your healthcare provider. Just keep in mind that the data points toward it being no more effective than a sugar pill. Number 2, Pygeum africanum, African cherry tree bark. Derived from the bark of the African cherry tree, pygeum has multiple potential mechanisms for relieving BPH. It may inhibit 5-alpha reductase, reduce inflammation, and block hormone receptors in the prostate. It received enough scientific attention to warrant its own Cochrane review in 2002. This review included 18 randomized controlled trials and over 1,500 men. The trials were short, typically about 2 months long, but they did find that men taking pygeum were twice as likely to say their symptoms improved overall. Nighttime bathroom trips dropped by 19%, leftover urine in the bladder decreased by 24%, and peak urinary flow improved by 23%. This sounds promising until you realize the studies were very short and not standardized. Although these results suggest potential benefits, we lack longer-term studies confirming pygeum's effectiveness. You might see pygeum combined with saw palmetto in multi-ingredient supplements, but keep in mind that we still need more robust data. Number 3, pumpkin seed, Cucurbita pepo. Pumpkin seed extract, often used in oil or pill form, also targets 5-alpha reductase and has strong anti-inflammatory properties. Some animal research even shows it might increase nitric oxide, leading to better blood flow and possibly smoother muscle relaxation in the urinary tract. Pumpkin seeds are also high in zinc, an essential mineral that the prostate contains in high concentrations. In one randomized trial, over 400 men took 500 milligrams of pumpkin seed extract daily for 12 months. They saw a 65% improvement in symptom scores compared to a 54% improvement in the placebo group. Interestingly, although there was some difference, the placebo group's improvement was still quite substantial. 54% is a very high, feel-better rate for those not getting the active ingredient. Another larger study involving 1,400 men confirmed similar improvements in symptoms but didn't see any major changes in objective measures like prostate size or leftover urine. Some experts think pumpkin seed might be more beneficial for bladder-related issues like urgency and frequency, rather than physically shrinking the prostate itself. If you do try pumpkin seed extract, pay attention to the label. It can contain high levels of zinc, magnesium, and phosphate. Too much of any of these can be problematic, especially if you have certain kidney conditions or you're already taking separate mineral supplements. Number 4, beta-sitosterol. Beta-sitosterol is a molecule found in many plants and cereals, structurally similar to cholesterol. It's believed to have anti-inflammatory effects and might even prompt the prostate cells to self-destruct when they proliferate too much. A 1999 Cochrane review looked at 5 randomized trials with over 500 men, finding that beta-sitosterol improved urinary symptoms and flow rates, but didn't shrink the prostate. Side effects were generally mild, mostly related to digestion, such as gas, constipation, or diarrhea. You'll often see beta-sitosterol bundled into multi-ingredient formulas that also include saw palmetto or pygeum. While it's intriguing that flow rate improved in some of these studies, there's still a lack of long-term research to tell us if the effect is consistent and sustained. Number 5, stinging nettle, Urtica dioica. Stinging nettle root extract is another popular herb used in combination with saw palmetto. This plant has anti-inflammatory properties and may inhibit the growth factors that fuel prostate enlargement. It might also interfere with sex hormone binding globulin, a key player in hormone regulation. There's no major randomized controlled trial looking solely at stinging nettle for BPH. However, one study combined stinging nettle with saw palmetto at doses of 120 milligrams of nettle plus 160 milligrams of saw palmetto taken twice a day, and followed participants for up to 96 weeks. Results suggested meaningful improvements in both symptoms and urinary flow rates. That's encouraging, but we can't be entirely sure which ingredient was doing the heavy lifting. Stinging nettle can have some noteworthy interactions. It may interfere with iron absorption and can cause hypoglycemia if combined with diabetes medications. If you have diabetes, kidney issues, or you're on lithium, blood thinners, or certain diuretics, you should definitely talk to your healthcare provider before adding stinging nettle to your regimen. It might not be the best choice for you. What about lycopene? Lycopene is a strong antioxidant found in tomatoes and other red-colored fruits like watermelon. It's been studied as a potential way to slow prostate growth by blocking certain growth factors, such as IGF-1. However, the existing research on lycopene for BPH is all over the map, with doses ranging from 10 milligrams twice daily to a whopping 500 milligrams twice daily. Studies have lasted anywhere from a few weeks to a few months, making it tough to draw firm conclusions. Some people prefer to get lycopene from whole foods, like tomato paste and fresh tomatoes, rather than supplements. That's generally a great approach, but keep in mind that tomatoes and tomato-based products can irritate the bladder. If you notice you're sensitive to these foods, a supplement might be a workaround. Though, again, the evidence isn't strong enough to say lycopene alone has a powerful effect on BPH. It can also affect blood clotting, so if you're scheduled for any surgery, you'll want to discontinue lycopene a couple of weeks beforehand. Are supplements worth it? Given all this information, you might wonder if taking a supplement is even worth your time and money. It's a valid question. Science often starts with small studies that appear promising, only for later, more rigorous research to reveal that the initial excitement was premature. We've certainly seen that pattern with saw palmetto. That said, many men are open to trying supplements for a month or two, particularly if they either can't tolerate conventional BPH medications or want to avoid them. Some men feel an improvement, which could be part placebo effect, part real physiological benefit, or a bit of both. The most important thing is to be informed and cautious. No matter which supplement you consider, always check the label for potential interactions with other medications you're taking. And if you notice uncomfortable side effects, especially anything beyond mild digestion issues, stop and consult your healthcare provider when it's time for medical treatment. Sometimes lifestyle changes and supplements simply aren't enough. If your symptoms are really impacting your quality of life, waking you up multiple times a night, making travel difficult, or keeping you from daily activities, it might be time to explore other options. From prescription medications like alpha blockers, which relax the prostate muscles, to 5-alpha reductase inhibitors, which can shrink the prostate over the long term, there are many choices. If medications don't deliver enough relief, there are minimally invasive procedures and even surgeries that can offer lasting improvements. Why worry? Well, over the long haul, a prostate that's consistently blocking urine outflow can weaken the bladder. If the bladder has to push hard against that obstruction year after year, it can lose its muscle tone. Eventually, even removing the obstruction might not return your bladder function to normal. So if you're on the younger side, or you're noticing progressive symptoms, it's wise to be proactive rather than waiting until you have advanced complications. Staying engaged with your health. No matter what route you take, remember that your health journey is personal. Supplements might give some mild benefits, or they might not. You could be one of those people who finds enough relief from a botanical product to get by without prescription medication. Or perhaps you'll need more robust options down the line. The key is to monitor your symptoms. Keep an open line of communication with your doctor and weigh how much any therapy, whether natural or not, improves your everyday life. Don't forget about foundational health practices either. Staying hydrated, maintaining a healthy weight, and keeping up with regular physical activity. These can all support better urinary function. Some experts even recommend pelvic floor exercises for men, which can help optimize bladder control and potentially ease mild symptoms of BPH. Final thoughts. An enlarged prostate can feel frustrating and even embarrassing, but you're not alone in this journey. With so many supplements on the market, it's crucial to look at the evidence, talk to a healthcare professional, and see if a particular product is truly right for you. While Palmetto has a substantial number of studies suggesting it does little to nothing, other supplements like pygeum, pumpkin seed extract, beta-sitosterol, and stinging nettle show pockets of promise, though generally in short-term or smaller studies. At the end of the day, don't be afraid to consider medical treatments if supplements don't cut it. Your comfort, bladder health, and overall well-being are what truly matter. If you haven't subscribed to our channel yet, I'd love for you to hit that subscribe button and tap the notification bell so you never miss our latest updates. Your support means the world to us. If you find this video helpful, please give it a thumbs up. It really helps share our message with a wider audience. I'm excited to hear your thoughts on today's topic. If you enjoyed the content, type yes in the comments below. If it didn't resonate with you, let me know by typing no. Your feedback is incredibly valuable and helps me craft videos that better suit your interests. Do you have a personal experience with prostate supplements? Or maybe a question about medication or lifestyle changes? Let me know in the comments. There's no one-size-fits-all approach, and hearing your insights can help others on a similar journey. Thank you for joining me in this deep dive into prostate health, and here's to living a more confident, informed, and healthy life. Disclaimer: this content is for informational purposes only and does not replace professional medical advice. Always consult with a qualified healthcare provider for personalized guidance on diagnoses and treatment options.